going to get today into is the basics. What is EMDR and how it works, why it works? Jackie, what is EMDR? What does it stand for and how did it start?
Okay, so EMDR stands for eye movement desensitization and reprocessing. It's a robust type of therapy that could stand on its own or it could integrate with other types of therapies. It works with just helping people with trauma, but the way we define trauma is sometimes different than the way that many people think of it as like something catastrophic. It's something that is distressing or disturbing and how it lands in someone's nervous system. So we're going to get into all of that. It was developed by Francine Shapiro back in 1987. That was a long time ago. Some people, I don't know if you hear this, Rotem, like, oh, there's this new type of therapy when it's really been around for decades. She was walking in the park when she realized that the eye movements that she was just naturally making decreased her emotionality after hearing something distressing. And from that awareness, that realization, and her just really delving into it through her studies, I believe she was in her doctoral program at that time, and just it grew over the years from like just eye movements to what we call bilateral stimulation that could be delivered through like auditory, visual, of course, or tactile. So it's came a long way since 1987.
Right. And I know that Francine Shapiro, since the beginning, since her, first walk in the park, she was very research oriented. So immediately after she experienced how eye movements affected her emotionally, she started with studies and she first explored it with colleagues and people she knew. And then she formulated a formal study that focused on showing the efficacy of EMDR. And I think that why we hear what you said that, oh, there's this new type of therapy, because there's so much research now that
Yes.
supports the efficacy of EMDR. And people are realizing that it really, really works very effectively.
Yeah, it's even recognized by the World Health Organization as an evidence-based treatment for trauma. That says a lot.
Right, right. I think it's recognized by um, many other organizations as a very effective evidence-based therapy. And I think that, we EMDR therapists, we see it work in our offices every day. And it's really an amazing experience.
It is. It's fascinating. I think even after being an EMDR trained therapist for all of these years, I still get wowed when someone is able to process through something that they've been carrying with them sometimes for like 6 or 7 decades. It is truly fascinating. It's life changing. I've experienced it myself as a client and certainly as a therapist in many sessions. And she really she changed the world when she created
Absolutely.
therapy.
Absolutely. So, Jackie, I wanted to talk a little bit about why it works, why EMDR therapy works. A lot of people are interested in why EMDR. Let's start by talking a little bit about why therapy works in general. And when therapy works, we know there's a process in the brain called neuroplasticity when the
Mhm.
brain starts to shift. So individual neurons change their firing patterns and neural networks start the process of integration. So any therapy that works leads to that integration. So the brain works in a flow state as opposed to chaos in the brain. And EMDR is really, really effective in rewiring these neural networks that are not always accessible with what we call talk therapies. So,
Yeah.
talk therapies, traditional talk therapies, we're trying to rationalize, we're trying to use our prefrontal cortex, our
Mhm.
thinking part of the brain, but we're not accessing the other parts of the brain. And the studies about both neuroplasticity in EMDR in the context of neuroplasticity, what happens in the brain during EMDR and even after EMDR are fascinating. So today we have fMRI, functional MRIs that can see in real time what's happening in the brain. And this is really, really interesting that we can see changes both in real time and over time. So we can see what happened, with these changes that happen in the brain 6 months and 12 months after the study. And again, EMDR is very, very effective in rewiring these neural networks.
Yeah, yeah. Literally, as you're saying that, Rotom, I'm thinking about like that's like the coolest. The fact that it can be seen because there's so much of it that is like we see the effects of it, but it's like the being able to see it visually. It puts some more weight behind it. When you talk about like, we're relying on the thinking part of the brain and other types of therapies, when we're in a state of distress, a lot of times our thinking part of our brain, our prefrontal cortex, our capacity to access higher level thinking is compromised. I think about Dr. Siegel, Dan Siegel's handy model of the brain. He talks about like we flip our lid and then we don't even have access to that. So to rely on that is it's a pretty big ask and expectation. And EMDR, it goes so much deeper. It even works with children. I've used it with people as young as 2 years old. So, and with people that spoke a different language. So it doesn't rely on anyone's understanding or recall. We can work on the like felt sense in the body. Really, what the goals of it overall. I think the goal is like reduce the emotionality and the image vividness. And I remember, gosh, it's been about a year ago, Rotem, that we were chatting, um, and you said, "What does you know what everyone wants?" And I was like, "What does everyone want?" And then you were silent. I was like, What does he think about?" You're like, "Transformation." That's what people want. They want transformation. They want to be able to heal in a way that's long lasting, in a deep way. And that's what EMDR offers. I think that
Absolutely.
word grabs it completely. That's like that. If you could describe it in one word, I would say transformational.
Right. I think that EMDR is a transformative form of therapy, again, as opposed to other forms of therapy that teach you coping skills. So they teach you how to cope better when you get triggered. And in EMDR, we're absolutely eliminating the cause of what triggers the client, the individual who comes to get the therapy. So we're really focusing on the core. And like you said, I love that you use the word healing, because that's what we do in the EMDR. We're healing. We're
Like
looking
literally.
right. We're looking at the big picture. We're getting into the core of what causes the symptoms. We're not just helping the client deal with the symptoms better.
Yes, yes. And what's so cool, like I think about like a lot of times when people are like new to therapy, they think, "Oh, I just need to learn how to cope, or I just need some tools or something like that." All of that is built into EMDR. It's not the only focus or the main focus. EMDR has 8 phases. So the first phase, history taking and conceptualization, we really get a good, clear clinical picture. Phase two, that preparation, we help the clients manage their affect. We help them to be able to build up the resources to be able to let's really be in the space to where they can proceed with reprocessing the stuff. Phase three, it's called assessment, where we really get into the components of whatever it is that we're working on. So it lights up those neural networks. And I know, Rotom, that's your jam. Like the brain so well. So I cannot wait to get into the pieces of that. But the way that we just pull out these pieces, it lights up the neural network, and then we move to phase four, and it's desensitization, which kind of sounds pretty dramatic, like desensitized. This is some big stuff. it really works. It
Yeah.
really works. And then through that bilateral stimulation, that alternating the stimulation from the right and the left hemisphere of the brain and the body, it lowers down that level of distress. And then we can move on to phase five, which is the installation of a positive cognition of I am safe now, or I'm good enough, I matter, whatever it is that applies to that one. Then phase six, the body scan, just noticing because trauma stores itself deep in the brain and the body. So sometimes there's some residual stuff left over that doesn't really have any cognitive memories or that is still in there afterwards. So we can kind of clear that out before the end of the session. And then we close down the session in phase seven, really helping the client to be able to acclimate to the present, to be able to go on and have their day in a state of regulation as much as possible. And then after they've left and they return back, we'll do a reevaluation in phase eight. And I know that's one of the ways that I've changed since I've been working with you, Rotem, is those last phases. I used to whip right through, like kind of quickly.
Right.
And your big thing, which I'm excited to explore, that is to let's really, really value those last phases and make the like phase five, six, seven, and eight really robust.
There's so much that we can do in these phases, and we will have a separate episode for each phase that will get in depth into each phase and how we can get better out of these phases. I noticed that with my consultees, what you said, that people kind of run through phases five, six, seven, eight really quickly,
Mhm.
and there's so much we can do with that.
Yeah,
I think that Francine Shapiro said that in EMDR therapy, we're not only helping to resolve the symptoms, we want to take our clients to the next level. So we want
to
that
grow.
transformation that you talked about. We want them to just not feel bad, but we want them to feel really good. And
Yeah,
that's an opportunity with phase five, with phase six. We can do these things.
yeah. Oh, it's so powerful. I think of it as like a gold mine, that if we don't explore it, it's just kind of it's untapped resources. I think about like healing, and then that takes it to the growth level. All right, so Rotem, if those listening are interested in EMDR therapy, whether they want to kind of get some EMDR therapy for themselves, or perhaps if someone's a clinician and they would like to get trained in, let's trained in EMDR therapy, what are the steps that one could take?
So I would look at the governing body of EMDR in a person's country. So we are in the United States, and we have
Mhm.
EMDRIA, which is the EMDR International Association. They are in charge of all the trainings, and they also have a directory for EMDR therapists. I think that when people are looking for EMDR therapists, they might want to look at experience, and if the person is certified or not. I think that the general public, if you're not an EMDR
Yeah,
therapist, you don't necessarily know the difference between a certified EMDR therapist or trained EMDR therapist. So do you want to talk maybe for a minute, Jackie, about what is it, the
yeah.
difference between a trained EMDR therapist and a certified EMDR therapist?
Sure. I do get that question a lot as a consultant and an advanced trainer. People say, do I even need to get certified? I think that really umbrellas too, like the person seeking certification or seeking EMDR therapy or the clinician. So basically, there's many different levels that one could go through as an EMDR therapist. So basic training is the first step. So you can find many basic trainings at emdria.org. Here in the States, there's just a really great opportunity for lots of choices for basic trainings. So once you've completed that basic training, it comes with the training itself and the consultation component. When you're finished, you are considered an EMDR trained therapist. A clinician can kind of stop there and they can go deliver EMDR therapy without any additional training from that point. Now, if they choose and they want to really hone their skills or just really sharpen their edge as an EMDR therapist, they can be certified. And I have to say that when I was certified, there are some things I didn't know that I didn't know. So it really, really changed my work. I was working with more fidelity, and I just started seeing quicker results. It made it to where I was doing EMDR therapy in a more robust, correct way, as I was trained, because EMDR basic training is so much. Sometimes it's like taking a sip of water out of a fire hose. It's just a lot to retain. So one could become certified. So if you're seeking EMDR therapy, looking for that certified EMDR therapist, you're going to get a therapist that knows their stuff. And it's a pretty robust qualifications to become certified. They need 20 hours of consultation. They need some more training. It's definitely a way to tell if someone's at the next level. Now, once someone's certified, then they want to consult with other therapists so they can go into what Andrea calls the consultation and training, the CIT track. And that's where they consult, and then they have another consultant that is like their consultant for the consultation. Sounds kind of confusing, but they get 20 hours of consultation just on their consultation. And that in itself is amazing. I worked with Dr. Andrew Dobo, which is incredible. I really honed my consultation skills and got better at EMDR in the same process. So once one is a consultant, then they may want to even go to that next level and earn their credential to be an EMDR basic trainer through EMDRIA. So there's a lot of steps you could take. So, but basically, anywhere along the way, as long as you're done with the EMDR basic training, then you can deliver EMDR therapy. It's fascinating. Also, one can become an advanced trainer later on in the stages, like we are Rotem, where they offer trainings that meet the requirements of EMDRIA. Each training goes through a screening process to make sure that it is high quality and teaching teaching EMDR in the way that it was designed, or any kind of new approaches are acceptable.
Right,
So,
right. So
so
EMDR is an integrative approach, but it has to, the trainings have to have some fidelity to the basic model. Okay, Jackie, that was really great. It's always fascinating to talk about EMDR. I think that we have this passion in common and we can talk about EMDR forever.
yes. Yes, that's why every time when we get to talking about it, it's like we spit off into all of these like exciting different avenues. So,
Well,
all right.
luckily, we have a whole podcast ahead of us. So we have a lot of EMDR talk coming ahead of us.
hmm hmm For those of you listening, if you would like to learn more, visit emdr-learning.com.
Yeah, that's the EMDR learning community. That's where EMDR therapists learn together. We have great speakers. Every month, we have a different theme. We have giveaways and weekly challenges. And this
So
is
good.
only for trained EMDR therapists. So, again, the EMDR learning community is at emdr-learning.com.
All right, Rhoda, until next time.